a 10-year-old boy risked losing his penis as he battles scabies, a skin itching and rashes condition spreading through the northeast region of Ghana. Many more communities have individuals reporting a fresh outbreak of the disease as the region awaits the delivery of a vaccine to deal with it. Correspondent Ilyasu Tanko is on that beat and he joins me on the phone. Good afternoon to you, Ilyasu. Tell us about this boy's situation.
Hi, so the community is called Yunyo Ranyile, just some few kilometers from the regional capital, Nalirgu, and we have been struggling through these isolated villages, speaking or meeting directly with patients of this particular contagious skin infection. And we visited this community over the weekend, and whilst we are at the Chief Palace, this boy pulled up and came to us and pulled down his panties, showing us exactly what was happening to his penis. And we saw red rashes on his manhood. We saw, open wounds on the manhood, and we saw blood oozing out of this particular wound. The boy is called Junior, and he said he was infected some 2 months ago. But because of a lack of money, the mother, according to him, has not been able to take him to see a doctor. And so they have been managing this particular condition in their own way. He is not the only one affected by this particular disease. We have more than 40% only in that particular small village inflicted by this particular skin infection, and it's causing so much pain and suffering to people in that particular area.
How bad is the spread, Ilyasu?
Well, we are not able to see the attack rate as to speak, but we are told that nearly 20 communities, mostly in the East Mamprisi municipality, are affected. And it is thought to have about 300 people, as to speak, are believed to be affected by this particular disease. And so it is widespread, if you ask me.
Interesting. But how are hospitals coping with this situation? Do you know?
Well, we're told that the outbreak actually happened some 4 months ago, but because the villagers did not understand exactly where disease was coming from, and so majority of them did not report to the health facility, even though we do know that the health facilities, none of them do have the vaccines for this particular disease, but people did not report to the health facility. And so it is now that many people are now going to the hospital, visiting the hospital and showing what is happening to or what has been happening to their skins to health professionals in that particular area. But we do know that health centers in that particular area are struggling really to provide vaccines for majority, these over 300 people who have been affected by this particular disease.
Thank you, Ilyasu Tanko. Ilyasu Tanko is our correspondent in the Northeast region. Now, joining also on the other phone line is Dr. John B. Eliza, who is the Northern Regional Director of Health. Good afternoon to you, sir.
Good afternoon. How are you, sir?
Very well, sir. But this disease broke sometime last week. What interventions are the people getting?
Scabies, the facility that we have, originally nobody was actually reporting at any of our facilities with the problem because they believe it was something else until our attention was drawn last 2 weeks when we sent a team there to investigate, and then we realized that we were dealing with scabies. And after that, we had arranged to get medication for them. You know, the medicine that is usually used for them, which is benzoate, is not something that is stocked normally. So we have to buy it from the open market and then get other medications which are, say, advanced because of possible secondary infections that they may, bacterial infections that they may have. For now, I would say it's tomorrow that they may start any mass treatment in the facilities.
Doc, do we know how widespread this is in the region? What has your research or investigations shown so far?
Oh, it's in the Mamprusi East or East Mamprusi district, and I can say that we are certain that we have it in at least 16 communities that are affected.
Wow. So how are you collaborating with the various hospitals to deal with this situation?
So like I said, the people are not getting to the hospital. It's now that we have made them aware that it's something which is treatable. And so in their locality, this does not need any complex treatment. Benzoate is a liquid you spray over the body. And so even at the chief's level, chief's compound level, it can be administered. So the district just acquired the medicine and they are yet to start the treatment from tomorrow, and they are adding some antibiotics to those that have bacterial infections, and then antihistamines because it's very itchy.
Well, listening to our reporter from that region, he indicated that there are no vaccines to treat the disease. How quick are you going to equip the hospitals to get these vaccines so that people can be treated?
I'm sorry, let me make a correction. Scabies is not treated with vaccine.
Okay.
There is nothing like vaccine for scabies.
Okay.
That's why I definitely mentioned that scabies is managed using benzoate, one of the common substances used. If you add anything to the treatment, it's because of the itchiness associated with the rashes.
Okay.
And we add various types of antihistamine depending on what the person tolerates. And you may add antibiotics only if you are certain that, or you can prove that the person has a secondary bacterial infection.
Okay.
Scabies is a mite. Okay? So you don't talk about vaccines when we are talking about scabies.
So, Doc, tell us about the causes of this scabies and how bad it is.
Yeah, that's what I said. Scabies is caused by a mite. And maybe if I want to be a bit technical, then, excuse me, then I'll tell you that the scientific name for it is Hello?
Yes, Dr. John Eliza, you're still on air.
Yes, I was saying that if I want to be maybe technical, then the scientific name for it is Staphylococcus scabies, and it's a mite, and it's gotten either from animals that you may be dealing with. Dogs, for instance, you can have the mites on it transferred to you, and that is it. And then they run on your skin, and so you realize that it's mainly areas that comes into contact that the rashes start. So it's a very tiny mite. You can't see with your eyes, naked eyes, unless maybe use a magnifier, then you can see them. They then breathe on the skin and then dig tunnels into the skin. And at night, they come out to breathe. And it's those movements that causes the itchiness, which is worse at night.
Doc, any timelines as to when we are seeing an end to this in the Northeast region?
Well, I'm sorry, I cannot give you timelines because as we speak, looking at the spread of it, there are people, contacts, who are yet to show symptoms. Because the incubation period for this disease is 2 weeks to 6 weeks for those who are first-time sufferers of scabies. Those that are having it, have had it previously, within 1 to 5 days, they start showing symptoms. So there are people who may be walking around there now who maybe have already gotten contact and are having the mites, but because they've not developed symptoms, may not seek care. So if I tell you to end at this time and those people start showing up, then, but what we want to do is those that are suffering now, we want to make sure that we have access to all of them and giving them the treatment.
But are there measures put in place at least to check the spread?
The spread it's a personal thing because the spread will depend on what you do in your house. If you are sharing beds with neighbors or with your house members of your household, then you are likely to continue spreading it. And if you infect your beddings or clothing and those things, you have to make sure you wash them or keep them right or disinfect them. Those ones, the health people we can only give education like we are doing now, telling you how it is spread. That one is by skin-to-skin contact or sharing of very intimate clothing material or beddings or towels and those things. So that is what we can do as far as health is concerned. But whether they will do what we have told them is another thing.
So you've done some education already on how to prevent the thing from spreading.
It's ongoing.
Many thanks to you, Dr. John Eliza is Director of Health in the Northern Region. We'll be monitoring the situation and update viewers on how the situation is dealt with.